Today I'm sharing what I consider to be the best eye drops for red eyes. And this video, like all of my videos, is meant to help you in a hurry. In this case, if you have red eyes. But sometimes red eyes happen due to an allergy or because it's allergy season, or sometimes you might be suffering from dry eye symptoms or even worse eye conditions like a viral conjunctivitis, an episcleritis, a scleritis. And so it is important to understand why your eyes are red so that you can handle the situation permanently. If we're just covering up red eyes, that's really not the point here. However, we're gonna get started with today's video talking about how to get rid of a red eye fast. So welcome back to Eye School. I am Dr. D. I have a private practice optometry clinic. I specialize in dry eye, and I make these videos in my so-called free time to teach you guys about dry eye syndrome and eye beauty so that you can have healthy, beautiful, comfortable eyes. Give a tap on the subscribe button down below to stay up to date with all the latest eye tips and tricks I have for you. So first, let's talk about red eyes. Number one, they can be from so many different things. If you have red eyes from an iritis, an episcleritis, something like that, you need care with a doctor. Let's face it, if you have dry eye or allergies, you need care with a doctor. But let's talk about some of the factors specifically related to red eyes from allergies and dry eye. So we're gonna talk lifestyle factors first. If you have redness and irritation with allergies and dry eye, there's some easy modifications you can make. Number one, taking an omega-3 supplement. And I do like 3 of them. I like Nordic Naturals, I like PRN Omega D3, and I like I Love. I'll link them all below. So my first piece of advice is to take omega-3 supplements because these are helping normalize your meibomian glands, reduce overall levels of inflammation, and dry eye and MGD and allergies even are inflammation, and so they're chronic low-grade inflammation, so taking omega-3 can be very helpful. My second piece of advice is to use a makeup remover at night. So I Love has great cleansers for around the eyes. I'll link those down below. But if there were to be a 10 commandments of dry eye and allergies and life, in my opinion, one of the first would be remove your eye makeup at night. Always, 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 without fail, never forget to do that because it's so, so important. Your meibomian glands can really suffer if you don't remove your eye makeup at night. The third is to try to keep a good diet. So avoiding inflammatory foods in your diet, things like simple carbohydrates, fried foods. These things are not good for the inflammatory state of your body. Rather, look for anti-inflammatory foods like salmon and other fishes. Nuts, walnuts, almonds. You can also look for blueberries and raspberries and oranges, but just better diet overall. Next, we have avoiding blowing air. So blowing air is your enemy when it comes to an impaired ocular surface, whether it's from meibomian gland dysfunction, allergies, dry eye. Blowing air in your face makes it worse. So no sleeping under an overhead fan. Turn the vents away from you when you're in the car because blowing air is only going to exacerbate those ocular surface symptoms. Next is increasing humidity. So for the winter months, increasing humidity in your workspace, in your living space, as much as is reasonable can really help because during the winter there's forced air, there's dry environments, and you might notice that the humidity in your home drops to dangerously low levels. Your skin might show this, your lips, but your eyes as well. And so using a humidifier in your environment can be incredibly helpful for dry eye. We also have nighttime eye shields as a modifying factor. If you tend to get dry overnight, you might never have heard of nighttime eye shields, but we have rubbery goggles that you can wear overnight to really seal off your eyes and contain moisture in your eyes. These are made by Eye Eco, and I'll make sure to link them in my dry eye rescue store down below. Also, moisture chamber goggles can help if you have chronically red eyes. They're fancy eyeglasses that contain tiny little sponges that you can wet with water and create your own personalized moisture-rich environment that's only for more severe dry eyes, but let's say you travel all the time and you always get red on an airplane. These moisture chamber goggles can be really helpful for red eyes. Also, cool compresses and hot compresses. So if you're suffering from allergies, cool compresses are phenomenal. Hydrate has their MediViz cooling eye mask. There's a Brooder eye compress cold therapy mask. There's an Optase cooling mask. All of these are great for swollen, itchy, red eyes. A cool compress can really soothe the swelling and cut the itch. If you're having allergies, you might also want to wash your face, take a shower after allergen exposure. So right after mowing the lawn, hop right in the shower. If your symptoms are especially bad because you've gone to your friend's house with a cat, then make sure to cleanse your face and eye area really well with an eye safe wash like the one from Hydrate. I love their tea tree oil soap bar and their foaming face wash. I think both can be great. I also recommend their eyelid wipes, which are an eyelash and facial scrub, and they're on Dry Eye Rescue. You can also find Clearadex wipes, tea tree oil extract eyelid cleanser for Demodex, and it helps with blepharitis and dry eye as well. You can also wear protective eyewear if that's your trigger. If you're going to be in an environment with plenty of pollen and allergens, one way to reduce the amount of symptoms and redness is to wear protective eyewear. Okay, so if your dryness and irritation is due to dry eye, it's very important to get to the bottom of your dry eye symptoms. I would always recommend seeing a dry eye specialist so that you can have a tailored treatment plan. However, if you have episodic dry eye that's related to occupational tasks like being on computer all day, and you're just suffering from some mild dry eye here and there, some of my go-to tips are: number one, examine your skincare and makeup routine and eliminate irritating ingredients. There's a number of toxic ingredients that we know about that are commonly in makeup and skincare, but ultimately this is a very individualized experience. You may be very sensitive to ingredients, preservatives, things that should not be toxic to other people might be to you. So the first place to look is your makeup and your skincare. The second is to remove any drops and ointments that might have BAK. If you've become addicted to artificial tears, non-preserved, or clear eyes, or get the red eye drops or Visine or different things, turn over that bottle and make sure what you're using does not have BAK, because benzalkonium chloride can be very irritating and cause redness. So eliminate that as an allergen. You can also use a warm compress. Now, warm compresses are a catch-22 because if you have rosacea, if you have a lot of blood vessels on your eyelid margin, I've seen warm compresses make redness and irritation worse, but they also have a positive impact on the oils in your eyelid glands. And so if you're getting clogged glands, I love the Hydrate mask because it covers the eye area really well. It's made with medical grade beads and you can reheat it over and over. So if you're a person that warm compresses help, then you can use warm compresses. Now, lid scrubs are underutilized, but cleansing the eyelids and making sure that they're calm and clean and free of extra dead skin cells and debris is very important if you have blepharitis and dry eye. There's a couple of products that are really, really great. You can use a hypochlorous acid-based product. Hydrate has some tea tree oil eyelid wipes as well as an eyelash and facial scrub. That's really great. They also have hypochlorous acid, and hypochlorous acid is used to decrease the bacterial load on the eyelids and to promote cleaner, healthier, and more comfortable lids and lashes. So if your red eyes have occurred because of lid inflammation, whether you just got lash extensions taken off or you just got a lash perm or lift, or you have known blepharitis, these cleansing things can help too. If your eyes are always just red in the morning, you can use a nighttime ointment. I'm a big fan of Retain PM. It's non-preserved. It can be put in right before bedtime, and it really helps protect your eyes overnight so that you can wake up with moisturized eyes instead of like red, itchy, irritated eyes. You can also use artificial tears or eye drops. So, artificial tears, always preservative free, never preserved. Why, you may ask, especially in light of recent news reports that preservative free artificial tears were having problems and giving people pseudomonas and blinding and killing them? Yes, still preservative free artificial tears, preferably one in a vial. Optase brand is a great one that has not had any issues. Over the counter ones like your Sustain and your Refresh, non-preserved, I am A-okay with. Retain has not had any issues at this point, and neither has Optase, which still comes in a bottle. Using an artificial teardrop with a preservative can be tougher on the ocular surface, and so I always advocate for non-preserved. For allergies, There are some great over-the-counter allergy options. The problem is most of them are a bit drying. You can get Pat-A-Day over-the-counter now, Lasticaft over-the-counter. Pat-A-Day Extra Strength is the old Pizeo that I used to prescribe. It's that 0.7%. And so you can get Pat-A-Day in many different strengths. Those all used to be RX and now they're over-the-counter. I also want to advocate for an over-the-counter oral medication for allergies if you have really dry eyes. So Orthomolecular makes a supplement called D-Hist, and I have been changing my patients from Claritin and Zyrtec and those other over-the-counter allergy medications that can be very drying over to Orthomolecular D-Hist with a lot of success. So definitely check that out, and I'll link my full script account. Hopefully I can link my dispensary down below so you can see some of my sort of natural supplemental things I use for dry eye. And finally, if you have red eyes, which you would expect, this is the first thing I told you, but I made you wait till the end. The only get the red out drop that eye doctors like is Lumify. So check out Lumify, gray box, purple accents, purple cap on the bottle. Lumify is excellent for reducing redness, but is still preserved with BAK. So it is not perfect, but if you have to use something to get the red out very quickly, Lumify is the only one I would recommend. All right, so hopefully this video, even though it was long-winded, helped you understand that sometimes red eyes happen due to allergies because it's allergy season, or sometimes they are mild or episodic dry eye symptoms. Either way, we've given you some tools to address both of those today, but if your symptoms persist, if they are worse, RSVP. You should always see an eye doctor if you have changes in redness, sensitivity to light, vision changes, or pain. Make sure to see a dry eye specialist if you're not getting the desired results from these over-the-counter options. And make sure to let me know in the comments below if you have further questions. If you have your solutions for red eyes, go ahead. Let me know. I'd love to hear it. And that is going to be it for today's lesson. Class is dismissed, and I'll see you soon.